The Integrated Neighbourhood Team Community Matrons are responsible for managing frail and elderly patients in their homes, with the goal of minimising the need for hospital or care home admissions. This video will demonstrate how ESP enables and supports their integrated working and information sharing across primary and community care settings, reviewing how patient encounters are easily recorded, notified and shared with the patient's GP. Click on Find Patient. Now search for the patient using any two of the identifiers shown here. Select Search. Click Search Other Sources. This drop-down menu provides the list of GP practices and organisations from which you can access patient records. Select the one you require. We will select the EMIS web practice. The search returns the matching patient. Select the patient. You must record the patient's consent to view their record. Two options are provided. Patient consent is used if they have sufficient capacity to grant consent. Implied consent is selected if they are incapacitated and access to their record is necessary to deliver safe care. For example, the patient is unconscious and the clinician needs to know the patient's current medications before administering any treatment. Add additional notes here regarding the circumstances of the implied consent in the text box. Consent is automatically recorded in their GP record with the associated read or SNOMED code. If consent is refused, you're not able to access the record. All access or attempted access by users and the consent granted is recorded in the service's detailed audit logs. A user may have access to multiple services and their associated clinical forms as shown. We will now review the information for GP from Community Matron form, how to create and share one, view and edit historical records. Select Create. This form, its design, content and workflow was designed by the Community Matron Use Group and associated GPs. The form has 3 sections. The green section is a subform that contains the patient's and their GP's details auto-populated from their GP record, which can be accessed and edited by clicking on this green square. For ease of use, click on the green button with the white tick, which displays the information contained in that section of the subform. The notes to be shared back with the GP are recorded in this blue section. Certain fields have mandated data entry, as illustrated here. Simply work through the form, completing each field. Conditional formatting means the entry in one field may open new ones such as prescription issued. We will enter some simple example information. Record patient's consent to share the information back with their GP. Finally, choose if the GP needs to be notified about the patient encounter and any aspects or tasks recorded. ESP will send a real-time notification to the agreed GP practice workflow email immediately the form is saved. This orange section provides a preview of the clinical précis that is automatically entered into the patient's GP record in EMIS Vision or System 1. Click Save. If no further or last-minute changes are required, click Save again to update the central ESP record and the GP record. These progress bars indicate when this is complete. Now we will take a quick look at viewing previous entries recorded for Mary Morris. Click History. A list of all previous entries is provided to the authenticated user displayed in date and time order with the associated author of that entry. Click Edit to enter the form to view its content and make any changes. That concludes the review of this form.